I would probably lose 75% of my patients if they did two things. Now, when I say lose, I don't mean that they would die. What I mean is that they would stop needing a psychiatrist. Now, this would not work for conditions like bipolar disorder and schizophrenia, but it would work for, I would say, most of the cases of depression and even with anxiety. Now, when I say work, it wouldn't make all of your problems go away and make it so you were never depressed again. But in most cases, it would do better than anything else that I can do as a psychiatrist. Now, before I share these things, I want to give a disclaimer. There are cases of depression in which nothing seems to work. Usually when this is the case, we go to more extreme measures like electroconvulsive therapy, TMS, ketamine, and there's even some really interesting research right now being done in the field of psychedelics, but that's not approved by the FDA yet. Also, I need to throw in here that there are some medical conditions that can cause depression, but most of my depression, most of the patients that I work with who have depression, I would guess if they did these two things, that their depression would become very manageable. The first thing is moderating their physical health. I would do this by eating protein, complex carbohydrates, and engaging in exercise. The exercise is actually the more important one, and there are studies on the exercise. 30 minutes of cardiovascular exercise a day, 3 to 5 times a week with a heart rate above 120. This performs as well or outperforms depression medications, and it outlasts them. Group exercise is better than exercising by yourself, but exercising by yourself is far better than no exercise at all. I would guess because humans also need social interaction to be happy, and the group exercise would account for that. The next thing I would recommend would be cognitive behavioral therapy. Now, if you don't think that you have time or money for cognitive behavioral therapy, I'll just give you one tip. One simple technique that I've done with patients. I've actually had a 100% success rate with this technique. What I mean by that is everyone that's done it has felt better. I'm not saying that they never are sad or depressed again, but they notice significant increases in their mood. The main problem that I've had is getting people to do it because it seems stupid. I usually can't get people to do it unless I explain to them something that I'm going to explain to you right now. And this is that you have a portion of your brain that talks to you all the time. It's turning ideas into words. And usually for depressed people, this part of their brain is really, really mean to them. It's constantly putting them down. Now, if you allow this part of your brain to function on autopilot, for most people, it'll get them stuck in the swamp. It's like having a parrot on your shoulder that's constantly telling you that you're a loser who doesn't deserve to live or be happy. Could you imagine trying to be happy with a parrot constantly shouting that in your ear? You're a loser, no one likes you, you don't deserve love. Yeah, it's almost impossible to be happy. But you can train this parrot, take it off of autopilot. It's not actually terribly complicated to do, but it requires consistency on your part. Every time that this parrot puts you down, you need to correct it. And then every day you need to train your parrot. Train the voice in your head. Hopefully you're understanding the analogy. Now before I go on, I need to explain something. If I were to hire actors and have actors come to you and they were to put you down in horrible ways, and I explain to you, these are just actors, just disregard what they're saying, you would probably still feel terrible because your brain responds to stimuli. Even if logically you knew that they were actors, you'd still feel bad. The same thing is true as if I hired actors to come and say really, really positive, nice things to you. You'd probably still blush, even if you knew that they were actors. Some studies in motivational interviewing showing that it's actually more important what you say to yourself than what other people say to you as far as predicting future behaviors. So, if you go to the mirror and you look at yourself and you say, "You are amazing. You are incredible. You are so smart and so good and so talented and so amazing and so wonderful. You deserve love. You deserve happiness. You deserve good things in your life. Dang, you look good today." And you just went on like this for a little while. Maybe threw something ridiculous in there like, "I am the champion of the universe. I can accomplish anything. I'm unstoppable." Just ridiculous stuff like that. And you trained your parrot to say those kinds of things to you? Could you imagine a parrot on your shoulder just saying, "Everybody likes you because you're so amazing. And if they don't like you, then something's wrong with them. So don't worry about it." It's so much easier to be happy when your brain is nice to you. So train your brain. Every single day, go to the mirror and teach your parrot to say these things to you. Smile as big as you can. Smile with your eyes. Throw both of your arms up above your head and shout for joy. And then say, "I am amazing." This sounds really corny. It sounds like it wouldn't work, but there's studies on this. And I've had lots of patients do it. And every patient that's done it has told me that they feel better. They feel good. Feeling better is right on the tip of your tongue. You just need to train your parrot, train your brain to be nice to you. Now, like I said, this isn't going to work for everyone, but for people who have a brain that's not nice to them, it can make a huge difference. Disclaimer, don't do anything without talking to your psychiatrist first. Don't abruptly stop any medications or make any medication changes without talking to your psychiatrist about it first and getting their approval. What I've shared in this video is my opinion based on my experience. Although I have located clinical studies that support some of the ideas that I've shared, these ideas are still expressed as my opinion. I hope that this video helps somebody. If you are suicidal, please go see a psychiatrist or go to the hospital to get help.